Deputy Eamon Gilmore. Deputy Eamon Gilmore. Without interruption, please. Deputy Gilmore, Deputy Gilmore.
Colocated, there's a report in today's Irish Independent that the numbers of children on hospital waiting lists is increasing, and it reports that the number of children who are waiting for 6 months or more for a procedure has gone up from 1,709 last December to 1,830 currently. Now, one of the things I think that everybody is agreed on is that there is a shortage of public hospital beds in our hospital system. There's disagreement as to how they are to be provided, and there is some disagreement as to the number of the shortage, but there is general agreement right across the board that there is a shortage of hospital beds. Now, the Minister for Health in July of 2005 issued an instruction to the HSE that they were to enter into co-location arrangements for the provision of beds. The idea was that sites on the grounds of public hospitals would be made available to property developers, that tax incentives would be provided for that, and that those private hospitals would provide 1,000 beds which would then be released to the public system. Now, originally there was supposed to be 10 of these. In the programme for government, the original programme for government, which was negotiated in 2008, we were told that those private hospitals, that the government would implement the plans for co-located facilities because this represents the quickest and most effective way of ensuring that public capacity is both increased and ring-fenced. In May of 2008, when I questioned the Taoiseach about this, he wrote to me and he said that approved bidder status had been approved for 6 of the hospitals and that it was expected that project agreements would be signed shortly for 3 others. In other words, there were to be 9 of these hospitals. Now, in the programme for government, which was renegotiated recently between Fianna Fáil and the Greens, this has been scaled back. What the new programme for government states is that the government will proceed with the current programme of co-location limited to already committed projects under existing project contractual agreements. We know from replies to parliamentary questions that contractual agreements have been signed for is 4 of those hospitals. In other words, what has now been agreed in the revised programme of government is that the number of co-located hospitals will be scaled back from 9 to 4. So I want to ask the Taoiseach first of all, if the number of hospitals, co-located hospitals, is being reduced from 9 to 4, how many hospital beds are now going to be provided? The original idea was that 1,000 would be provided. How many are now going to be provided? Secondly, when is construction work going to start on the 4 hospitals? And thirdly, when are we going to see the first of the beds that were promised by Minister Harney in July of 2005, when she said that the purpose of this was to fast-track the provision of hospital beds? Colocated, I do appreciate that the Taoiseach didn't have advance notice of my question, but this is a subject that shouldn't be unfamiliar to him. One of the central issues that was debated at the time of the last general election was the issue of hospital beds. And there was a debate about, first of all, the number of hospital beds that were required. The country was full of posters with the respective figures on them. And secondly, there was a debate about how they were to be provided. Now, your solution was, you said that, and it's in the programme for government that you brought in here after the election of the government, that you would increase the number of dedicated public-only hospital beds by 1,500. And you were going to provide 1,000 of those through the co-located hospitals. Now, here's the problem. The number of co-located hospitals that you planned was originally 9. That's now dropped to 4 under the recently revised programme for government. So my question to you is this: how many hospital beds does the government now intend to provide? What's the number? Up to now it's been 1,000, it's been accepted as 1,000, and you had a formula by which to do it. Well, first thing is, what's the number of hospital beds the government now intends to provide? Because clearly you can't provide 1,000 with 4 if you were going to provide it with 9. Secondly, what is happening to the co-location arrangement? We're now told it's down to 4. When are those going ahead? When are we going to see a bed produced under this? Minister for Health, when she announced this, and it was an instruction she gave to the HSE. HSE was reluctant to go down this road. Minister for Health instructed the HSE that this was the route that the government was going, and she justified that at the time by saying that this was going to fast-track the provision of hospital beds. That's over 4 years ago. We still have none of the beds provided, no sign of these hospitals being built, and now under the revised programme for government, the number of such hospitals is being reduced from 9 to 4.